Now, our lecture today is ischemic heart disease, which is one of the subjects of dental management. So, ischemic heart disease, actually, these are group of diseases occurring due to ischemia or necrosis of the heart. The cause or the most common cause of ischemia or ischemic condition of the heart is due to atherosclerosis of coronary artery. Because in case of atherosclerosis, this is the normal condition of the coronary artery. In case of the atherosclerosis, there is atheroma, and this atheroma decreases the lumen of the blood vessel and so on, decreasing the blood supply to the heart. So in this case, if there is decrease in the blood supply to the heart, there is imbalance between O2 supply and the demanded O2 by the heart. The ischemic heart disease can be classified into stable angina, unstable angina, and myocardial infarction. In case of stable angina, the attack usually occurs during exercise, during eating, and even during emotional stress. The condition can be resolved by medication or when the patient gets rest or at rest. There is no change in the severity and duration of the condition. In case of unstable angina, the condition attack at rest. That means there is no triggering factors. And the condition does not resolve by medication or even at rest. It is more serious. I mean, the unstable angina is more serious than stable angina because there is a progression in the frequency of the attack. The condition may develop into myocardial infarction or may followed by myocardial infarction. Myocardial infarction, actually, it is also one of the ischemic heart disease characterized by severe chest pain, but the pain may last more than 15 minutes. In case of stable angina or unstable angina, the pain or the central chest pain may last from 5 to 15 minutes. But in case of myocardial infarction, the condition may last, or the pain may last more than 15 minutes. The complication of ischemic heart disease is congestive heart failure. Actually, congestive heart failure in which the heart fails to work, to pump blood properly. Dentists should be aware of this condition. Why? Because due to dental procedure, there is stress and anxiety, and also because of the vasoconstrictor and the local anesthesia, this may aggravate or may trigger the condition. In addition to that, the patient may take also anticoagulants or antiplatelets to make the blood flow easily or smoothly, and also to prevent the blood clot formation. So this also may cause bleeding, local bleeding. The sign and symptom, usually the patient presents with central chest pain, but the pain also may radiate to the upper arm, left or right, to the shoulder, to the palate, or even to the lower jaw, left side of the mandible. Patient may present with dyspnea, difficulty in breathing, palpitation, which is increased in the heart rate. Patient may also syncope, that means loss of consciousness because there is decrease in the blood supply to the brain. The condition is developed to myocardial infarction. Actually, there's differences, as I mentioned before, in the time of myocardial infarction. The pain in case of myocardial infarction may last more than 15 minutes, while in case of angina, it is usually ranged between 5 to 15 minutes. If the if the condition developed to congestive heart failure, in this case, the sign and symptom becomes more clear. So the patient may have distension in the neck vein and also ascites, accumulation of fluid within the abdomen, and also cyanosis, which is huge discoloration of the lip and even the face. Sometimes the patient also presents with hypertension, elevated or increased in the blood pressure, so which could be a sign as one of the causes of atherosclerosis or even the ischemic heart disease. Medical treatment is the responsibility of the physician, not the responsibility of the dentist. The drugs can be given nitroglycerin, which is vasodilator, to prevent the narrowing of the blood vessel or to relieve the vasoconstrictor. Actually, it acts as vasodilator. These could be sublingual tablet, could be oral tablet, or could be dermal, short acting or long acting. Beta blockers to reduce the heart rate, calcium channels blockers. Actually, this is to uh, for treatment of blood pressure, because as I mentioned before, sometimes the patient may present with hypertension. Ranolazine, actually, this is also can be used to relieve chest pain. Antiplatelets such as aspirin or clopidogrel, actually, or anticoagulants such as warfarin. This is to prevent the blood clot formation, which is one of the causes of narrowing of the lumen of the coronary artery, and also to make the blood flow easily and smoothly in the blood vessel. Dental management of stable angina. Actually, in this lecture, we discuss the dental management of stable angina. Dental management of unstable angina or myocardial infarction will be discussed in the next lecture. So this lecture uh, will be dedicated for the treatment of how we can manage patients with stable angina. First of all, short morning appointment. Actually, it should be short in order to reduce the stress and anxiety. Morning appointment should be not earlier morning. It should be in the mid morning. I mean, in the 10 o'clock or something like this. Dental chair should be in semi-supine position, not in supine position, because the patient may have dyspnea, difficulty breathing. Check vital signs such as blood pressure and pulse rate. An anti-anxiety protocol can be given, such as benzodiazepam, 2 to 5 milligram, at bedtime or 1 hour before dental procedure. Nitrous oxide, actually this is gas, can be used as sedation also. Patient should be advised to bring his hair oil medication, nitroglycerin, in case there is severe chest pain during dental procedure. Administer prophylactic nitroglycerin sublingually in case we anticipate or we expect there is pain due to dental procedure, so we can give the patient prophylactic nitroglycerin. Use plain anesthesia. Plain anesthesia, that means anesthesia without vasoconstrictor. We can use actual vasoconstrictor, but it should be of low concentration. It should be 0.036, 36 milligram. And the maximum carboos, 2 carboos for patients with ischemic heart disease. Avoid gingival retraction cord because it contains epinephrine, and this may cause vasoconstrictor and also increase the heart rate. Avoid anticholinergic drugs such as atropine and scopolamine because this is actually decrease the heart rate. Aspirin may cause local bleeding, and this can be controlled by local pressure. Pre-treatment checking of prothrombin time. Prothrombin time actually it measures the extrinsic pathways and common pathways of coagulation cascade or coagulation process. And the normal range or the normal measurement it should be from 12 to 13 seconds. An international normalized ratio. Actually, international normalized ratio, this is ratio for the average measurement of the prothrombin time. The prothrombin time for patients with ischemic heart disease are taking anticoagulants, it should be 2 times less than the normal value. And for the international normalized ratio should be less than 3. Discontinue and postpone or schedule the appointment when patient becomes fatigued. Should be postpone the appointment. General anesthesia should be avoided because the patient already has difficulty in breathing. So this is the end of the lecture, part 1, and thank you for your attention.